Welcome back to Healthcare Insight on America's Web Radio. There are several really important questions for anybody looking at these concepts and how do we make it real. But maybe the most important question is why MAGA Health? And we're going to talk about how MAGA Health is designed. But the question of why has got to be on everybody's mind who really wants to get into this. How do you explain it to the general public? How do you, if you're an elected official, support the idea of why MAGA Health, now that I've used that name? And I don't really mean to politicize this, but I don't see how we get together at this point and develop a bipartisan solution. So why MAGA Health? Well, because MAGA Health builds on the current employer-sponsored and then more importantly, maybe employer-subsidized health insurance financing system. Americans prefer private health insurance. 71% of Americans are satisfied with their current employer-provided health coverage. That represents a 93% satisfaction rate for the 76.2% of Americans age 0 to 64, non-Medicaid, non-Medicare Americans who get their coverage through an employer-sponsored, employer-subsidized group plan. Now, we'd love to have more portable individual insurance, and MAGA Health builds on that, allows for that, supports that. But let's start where we stand today, and that is most Americans get their insurance coverage for a lot of historical and tax subsidized reasons that the government's encouraged in the past. But the reality is most people get their insurance through employer-sponsored group health insurance plans. Now, it's real easy for large self-insured plans to provide subsidized coverage. It's harder for that smaller under 50 life group that's really starting up, maybe is stabilized in a local or regional markets, doing good business. It's harder for them to access good health insurance. But employer-sponsored self-insured plans, which are the larger plans, cover 60% of U.S. workers. These plans use insurance companies as administrators and processors of their claims, not as risk-bearing entities, not as risk-bearing insurers. So while we call them insurance companies, and they go by the same names of Aetna, Cigna, United, Humana, whatever, Blue Cross programs, they're not really acting as insurance companies. They're not really at risk for any high level of claims. That risk is borne by the employer. The employer will get some protection from what they call reinsurance, that if one individual claim is very large, then a reinsurance contract will pick up that very high level. Or they can get what's called aggregate insurance, so that if the overall group has a bad year, that the employer can get some protection so that that employer doesn't go bankrupt from some unexpected, very high group claim or individual claim. Now, these self-insured employers, on average, contribute over 75% of the cost of health insurance for their employees and their family members. Isn't that a much better way to subsidize health insurance than government subsidies, which include tax monies? Have the employer subsidize. They will subsidize on average today 75% of the cost of health insurance. These self-insurance plans have been able to avoid much of Obamacare because they are mainly regulated by a different set of federal laws. Without getting too far into the details, they're controlled by what's called ERISA laws, which are different than fully insured plans, which are typically covered both by Obama and by state regulations. Self-insured plans are not covered by state regulations. That's why a nationally based company with employees in all 50 states even can provide a uniform plan that doesn't violate individual state laws, restrictions, and mandates. They're not covered by those state laws, restrictions, and mandates. They're covered by a federal law called ERISA. And on that critical issue of pre-existing coverage, self-insured plans have always covered pre-existing conditions with minimal restrictions. So basically, you're being covered by pre-existing conditions if you're in a large self-insured plan and you or a family member has got a pre-existing condition. All working Americans should have access to affordable, employer-sponsored health plans. Unfortunately, many small, fully insured plans do not offer such coverages with employer-subsidized premiums. This is the critical issue, as 40% of American workers are in small businesses or are self-employed. Nationally, less than 3 in 10 businesses of less than 50 employees offer health insurance benefits. So this whole idea that we're developing in this series of podcasts and videos, this whole idea of MAGA Health, well, MAGA Health focuses on small businesses and the 28.5 million uninsured families that are low-income families and have at least one worker in the family. Now, we know that the individual mandate failed because Obamacare tried to force young people into buying insurance they didn't want. They tried to increase younger people's premiums in order to pay for the older folks' premiums. And Obamacare mandated that premiums for older folks cannot be more than 3 times that of younger folks. All sounds great at first, but that's not the reality. Older folks actually cost 5 times more. So you raise the premium of young people in order to lower the cost for older people. And then for the younger people, Obamacare was to provide subsidies for younger people who are also typically lower income earners. Well, all that sounds great at first. But let's take that younger person. To cover expected claims, the total premiums must be the same, even if Obamacare cannot change Mother Nature and try to make it a 3-to-1 cost ratio versus a 5-to-1 in reality. So what happens is that, let's take an example. Let's say there are $6,000 of claims and you only have 2 people involved. How do you cover the $6,000 in claims? And let's forget about administrative expenses, insurance expenses, and all those sorts of things. Let's talk about just the claims part. Well, to cover $6,000, you would typically, under the real world assumptions, the expected level of claims would be about $5,000 for a person age 60 or so, and $1,000 for the person age 20. So $5,000 and $1,000 gives you the total cost of $6,000 that would cover the claims. That's a 5-to-1 ratio. Age 60 is 5 times the age 20, 5,000 versus 1,000. So what did Obamacare do? Obamacare said you can't charge 5,000 and 1,000. You can only have a 3-to-1 ratio. So what you do, you lower the age 60 premium from 5,000 to 4,500, and you increase the age 20 from 1,000 to 1,500. So you now have the $6,000 in expected claims covered by $4,500 from the person age 60 and $1,500 from the person age 20. Those two numbers together add up to the same $6,000 with the 3-to-1 relationship between age 60 and age 20. Sounds great. Get the same premium, so cover the same claims from the insurance company's perspective. They're perfectly fine with it. But what about that person age 20? You just raise their premiums under Obamacare from $1,000 to $1,500, a 50% increase. Well, they didn't like having to pay $1,000 pre-Obamacare, and now you're going to charge them $1,500 under Obamacare? That is the core of why Obamacare failed. I know I threw out some numbers, and for the many of you out there who don't like to hear numbers or not number savvy, I hope I was clear enough to point out the fact that the core of Obamacare was this idea of let's charge young people more to pay for older people. And the example I just showed that people age 20 and in that age range, younger people, are not going to pay 50% more on a premium that they didn't like to begin with. So it's no wonder they avoided Obamacare. Now, the way Obamacare tried to force that age 20 person to pay a 50% higher premium was to provide for an individual mandate under the law that said you have to do that or we will penalize you. Well, the young people said, go ahead and penalize me. I'd rather pay a small penalty than have to pay $1,500, an extra $500 that I didn't really want to pay to begin with. So the individual mandate was the linchpin of Obamacare, and the reason it ultimately failed, because people just didn't want to pay for that individual mandate. They didn't want to pay the penalty. And so ultimately, finally, the Trump administration got rid of the individual mandate. So now young people aren't going to be penalized, but they still don't want to buy the higher cost of Obamacare, because while the individual mandate was eliminated, the 3-to-1 ratio was not eliminated. Now, let's go back to that self-insured arrangement, because this is why MAGA Health is important, why we need it. Basically, Obamacare did not anticipate the growth of self-insurance plans to avoid many of the Affordable Care Act mandates. Self-insured employer plans are explicitly exempted from some of the Obamacare mandates. Self-insured plans are not required to provide coverage with a minimum essential benefits. They have much more flexibility around plan design. They are not required to participate in a risk adjustment system. They are not subject to single pool standards, and that's really critical. The single pool standard is also what kills the small market and individual market. And the large employers on self-insured are not subject to that crazy 3-to-1 pricing compression as we described, and other rating mandates. They're not subject to the medical loss ratio mandates that require insurance companies to pay out so much of the premium in claims, and ignoring the fact that some of those administrative costs actually go to help change behaviors and lower the overall cost of healthcare. So it's a very short-sighted view of health insurance when you have a restriction on the medical loss ratio. Also, self-insurance plans are not subject to the review of any premium increases, because you're basically charging the level of costs that an employer is actually facing. And each employer could be different, an old group or a young group, a healthy group, a not healthy group, the employer doing other things to help assist employees in good health and healthcare decision making. And they're not subject to the annual insurance fee that started in 2014 for fully insured plans. And there were a number of pre-Obamacare benefits of self-insurance plans that were retained. Obamacare didn't get rid of them. Self-insurance plans are not subject to state premium taxes. They're not subject to state coverage mandates, and they're not subject to insurance reserve requirements. So Obamacare just exacerbated the differences and cost implications between fully insured and self-insured plans. Obamacare unwittingly expanded the reasons for employer-sponsored plans to adopt self-insured or self-funded health insurance plans. So guess what? Now health insurance plans aren't offered just to large employers. They're being offered to plans as low as 2 lives. And we'll talk about how and why that's occurring after this next break on America's Web Radio. We'll be right back.